Good afternoon, and thank you for joining us. I almost fell off my stool at Strategic Healthcare with Dawn and Matt. I was trying to be a little comedical today.
How'd that work out?
That didn't work out so well, but it would have been pretty funny if I was laying there on the floor. Again, welcome to Strategic Health. Thank you for joining us today. We're going to talk a little bit, Matt, because we've got all kinds of things going on. So we're going to talk a little bit about the jobs, but I really want to throw something out there to everybody listening and today and watching is here at Strategic Health, what we have available right now is an urgent need for recruiters. We now have so many jobs and so many nurses that we're trying to get nurses hired. We don't have enough people doing it. We have a capacity for 20. We're just about there now, so we're just looking for a few more good people who are interested in sales. Come on down to 300 West Main Street in Smithtown and either ask for Matt or myself, and we'll give you an interview on the spot. These jobs are, hot, good opportunity for you to make a lot of money. You can kind of set your own hours because we do deal with California and Hawaii and Alaska, which give you the opportunity to work some late hours. But for the most part, we're here 9 to 6 for the support. So before we got started, Matt, wanted to throw that out there because that is one of our urgent needs personally. So if you know somebody, please have them give us a call or get online and send us an email or stop down, any one of the above, I guess. So what I also want to talk about a little bit today is all the jobs we have. Because like I said, we have well over 1,000 jobs available out there. And what we're starting to find out now is we've got the jobs up here in New York, New Jersey, Pennsylvania, and New Hampshire with high bill rates, which is going to yield you a gross of anywhere to $1,900 a week and on up. And we can help you get licensed. So what I need you to do is, again, get in touch with myself or Matt and let's talk about what you want to do, because I'm in need of nurses that want to go to the northern states now. All the snowbirds are coming back, so the hospitals are in need of nurses and things like that. We still have them in the warmer states, but today I got, looks like about 20 jobs came in, 13-week jobs that we can get you placed in about 24 hours. I have a PT job, I have several RNs, I have a practitioner's job. I have L&D, so a lot of things happening. I know we just got a nurse hired on to Hawaii that's going to be leaving in a couple of days, right?
Going to be leaving for Hawaii. We just had a nurse start in Las Vegas this week. She would a 48-hour turnaround from interview to hire, and she moved cross-country, hopped in a car last Wednesday, made it to Vegas on Sunday, and she started work today.
And then I had one that was in Texas.
That's in Texas, yes.
And in between contracts, we are sending her to Las Vegas. Now, the interesting thing about Las Vegas, for all you nurses that are interested, there is a 2-week turnaround for licensing. And if you happen to be in Texas or one of our states where we have per diem, what I did for this nurse is we've got her signed up for the license in Nevada, not Las Vegas, yeah, in Nevada. She's going to, during that 2-week period, work per diem in Texas.
Yep.
And then following that, she's going to go right down and start her job in I'm not sure if it's Reno or Vegas, one or the other. And one of the things we also talked about today is how quickly we can get you licensed in California, as opposed to, what they've been telling us, 3-4 weeks. So we'd like to get, again, Nevada. I won't say Las Vegas again.
That's okay.
I'm really off my ticket today.
But that's okay. There are a lot of opportunities in Las Vegas itself as a city, which at this time of year people are drawn to it for the weather, for the social environment, and also now for the jobs. So there's a lot of opportunity. We have a good standing relationship with our vendors out there, and they're desperately, well, not desperately, they're seeking a lot of opportunity from us as an agency to fill their spots.
And that has a lot to do with the census. Census are up, so they need the support in the operating rooms and in the L&D, ICU. We're seeing a lot of ER nurses that can do, which is kind of an interesting thing, med-surg nurses, ICU nurses in the ER. This particular job that we had in Vegas wanted an ICU nurse for the ER that could rotate through neuro, and peds, which is a really interesting combination. So you have to be well-rounded, but it was a top dollar paying position. So if you have those qualifications, again, you can reach me at dbowerman@strategicnurse.com, or Matt is mprice@strategicnurse.com. And we really, again, can help you with your license, can help you with your lodging, can help you with your travel, can get you the jobs that you want. And again, getting back to the nurse that I talked to for the Vegas job, one of the things that I'm also doing for her right now, not only getting her Nevada, California, we're doing New York State, and I think New Hampshire was another one that she wanted. So we don't even know if she's going to have opportunity there, but we want to make sure she's ready. And then we're going to put her in the system, credentialed for any additional per diem jobs. So when you have a recruiter that really knows what they're doing, like our top recruiter, which I should have brought his award today. I'll have to bring that for you next week. He's our top man recruiter, and we've got things to prove it. So next week you'll have to tune in and see that. So I'll bring that up next week.
Okay.
But anyways, our top recruiters will help you get your licenses, get you in the places that you need to be, even before the jobs exist. So we've kind of mapped out the next 6 months for this nurse, knowing where she wants to go. So, you know, that's important. And then she told me she wants to get back to Florida in the September, October area. So, you know, I've almost, just like, you know, planning your year or your goals or whatever that is, we've done the same thing. So that's what we train our recruiters for. And today, if you happen to get some calls, we're doing a blitz down in the office. Everybody's down there calling and winning fabulous prizes. I had to make sure it was still in my pocket, the fabulous prizes. And, you know, so they may be calling you and reaching out for jobs. So I hope that that happens. If it does, please give us a call back. If you're interested, give us a call, and we'll make things happen for you. So again, man, I know you have some jobs there.
We've got some job opportunities here. A speech language pathologist for Massachusetts. I'm sorry, Rhode Island. So that'll actually.
Hey, I almost said that. I was going to say that doesn't say Massachusetts. That says Rhode Island.
That's Rhode Island. So
it's easier if you put these on.
I'm not putting them on television.
Hey, you know why? He's still
much.
recovering. He was in Atlantic City this weekend. So if any of the loan sharks are looking for him, 300 West Main Street in Smithtown.
I paid them off already.
There you go. Puppy came home, right?
Yeah, he finally came home. An OR nurse need for Los Angeles. This just came across today for Southern California. We also have a physical therapist need in Arizona. These are all 13-week jobs, by the way, with attractive bill rates. As Dawn had mentioned earlier, it gets you a better payout when the bill rates are nicer. If any of you folks want to go to Alaska, there's a nurse practitioner job open in Alaska for a 13-week facility.
And I'll tell you what, I don't know if that's the facility, but I thought what was interesting about Alaska was we had a nurse that was actually going to get taken into her job by helicopter, dropped off, and not picked up again for 13 weeks.
No roads in, no roads out.
No roads in, no roads out. Yeah, that just was a little scary.
You'd be surprised at the number of people that wanted that job, too. It's pretty amazing.
Yeah, not me.
Not me neither.
There's not a beach attached to that, and a cold margarita or pina colada, I'm not going.
Well, no, who's to say that you couldn't make a margarita or pina colada
out of the snow?
In the snow. Yeah. In Oklahoma, med-surg nurse needed for a 12-hour day shift. Again, these are brand new jobs that just came out today. Also, a physician assistant in Alaska. We talked about that. Another occupational therapist in Arizona. So, again, we get about 150 to 200 new jobs per day. And as Dawn mentioned earlier, we have well over 1,000 new jobs. They are available. Give us a call or email me or Dawn. My email address is mprice@strategicnurse.com. Dawn Bowerman is dbowerman@strategicnurse.com. Email us, get us your resumes. We'll put your profile in our system, and we will market you today. So give us a call or email us as soon as you can.
He just wanted to say that. And, you know, I apologize. I left our screenshots in another suit, so I was unable to put those up there. But, again, you can also go online, visit us online, and you can fill out your profiles, get our phone numbers, and we'll be happy to help. You can also, you know, drop us an email, and we'll follow up with you that way, whatever works. Now, in closing, I just want to leave you with just a little something. I've been talking a lot to the nurses, and they ask me questions about their health insurance, Matt, and if they really should take health insurance for the 13 weeks, or if they should just self-insure. Now, of course, this is their total decision because in some cases it costs them additional funds, and sometimes it's covered. It just depends on the job. But a couple of things that I've told them that they need to ask the question is, if their deductible is continuous following each of the jobs, if they stay with the same agency. So in other words, if they have a 13-week contract and it ends and they take 2 weeks off and they take another 13-week contract, when they start back up, does that deductible start again or is it gone? So that's an important question to ask your provider. The next thing is you want to find out about your COBRA, and if you're going to take it with you, how much is that going to cost you? Here what we do is we have several options. You have options to take health care benefits or not, and then we have some supplemental policies that we can offer that might suit them a little bit better, because sometimes self-insuring yourself is a less expensive route to go, especially if you're healthy and have had your physical and all those kind of things. So it was a concern today with a couple of nurses, so I thought I'd throw that out because that'll make a difference of what you can take home in your pay, and also of where your money's going. And if you do have something come up and you've already spent $500 in deductibles, you want to make sure that that carries over. So good questions to ask. You should always get a copy of the policy and your cards from your recruiter once you start the job. So if you're not getting that, please make sure that you ask who you're using or give us a call. Our recruiters all provide you with a welcome packet that has that information all in there. So it's important that you know those things.
That's all I got today, Dawn.
Me too. So I want to thank everyone for joining us today. We look forward to seeing you next week, and hopefully one of these times we're going to get to see some off-location shots if I can get my act together here. So thank you again. We'll see you all next week.